Weber and Rinne tests for evaluating hearing loss, conductive or sensorineural. So we need a fork for those two tests. Let's start with the Rinne tests. The Rinne tests take this fork, we take active rotation of this fork, and in Rinne we put it on the mastoid. We tell the patient that tell us when you don't hear anymore the sound throughout the bone, and when he says I don't hear anymore, you put it around some centimeters, 1-2 centimeters from the ear canal, and ask him, do you hear now the vibration? What's the idea? The idea is that evaluating sensorineural or conductive. If the patient has a conductive hearing loss, he will hear the sound better throughout the mastoid, throughout the bone. So when he will stop here throughout the bone, he won't hear it throughout the air. But if the patient has normal hearing or sensorineural hearing, but without the conductive part, he will hear it better throughout the air than the bone. So this is the idea. If he has a conductive hearing loss, he will hear it much better throughout the bone than the air. If he has a sensorineural or normal, he will hear it better throughout the air than the bone. Now Weber tried to identify quite the same idea. So the Weber tells you to take the fork and vibrate it and put it somewhere in the center. If the patient has a conductive hearing loss, the sound will be much better heard in the ear with the conductive hearing loss. If he has a sensorineural hearing loss, the sound will be heard better in the better ear with less sensorineural hearing loss. So Weber will go to conductive side or anti-sensorineural side. Why do we need both? We need both because, for example, if you have a normal Rinne in this ear and in that ear, how do you know if there is a sensorineural hearing loss in one of them? Weber, if it will be lateralized to one side, will tell you that if you saw in the Rinne that in both the air is better than the bone, so if it lateralized to this side, the Weber, the sensorineural hearing loss is in this side. So Rinne and Weber together can give you a picture about conductive hearing loss and sensorineural hearing loss. Normal Weber is when you put it in the center and he hears quite the same in both ears, namely it tells you that the sound is in the center, not lateralizing to any side. So sum up, if we have a positive Rinne, this is normal. Negative Rinne, you heard it better throughout the bone. Lateralizing of the Weber, if it lateralizes to this side, if the Rinne is negative, namely bone problem, the hearing is worse in this ear. But Weber to this side and normal Rinne, so the sensorineural is in this ear. This is why combining the two can help you.